Let's be really clear about something from the start. This isn't just a story about a construction project that's running late. This is an explainer on how a national necessity, a state-of-the-art hospital for Ireland's sickest children, became a masterclass in governance failure. It's a story of how a democratic state completely lost control. On one side, you have the promise. It's simple. It's morally unassailable. On the other side, you have the reality as it stands today. A staggering bill and an empty building. The enormous gulf between these 2 points, well, that's where our story lies. So to really get our heads around how this happened, we're going to break it down into 6 key parts. We'll start with why this project seemed untouchable, then dive into its exploding cost, the endless delays, the legal battles, and finally we'll get to that crucial question. Who, if anyone, has actually been held responsible? Okay, first up, you have to understand why this project was, for all intents and purposes, politically untouchable. For decades, Ireland needed to merge its 3 old paediatric hospitals. The public was demanding it, clinicians desperately needed it, and so, of course, politicians championed it. This was a project that simply had to happen, which kind of made it seem immune to failure. That political necessity, that feeling that it had to be done no matter what, well, it set the stage for the first huge pillar of this crisis, the money. How on earth did a project that started in the hundreds of millions spiral into the multi-billions? When construction finally got underway, back in 2016, the cost was understood to be around €700 million. Now, that's a significant national investment, for sure, but it seemed manageable. Then, just 2 years later, the first shockwave hit. The government had to admit the cost had exploded to over $1.43 billion. It more than doubled before the structure was even halfway complete, and the climb just didn't stop. In February 2024, the government approved a new, official, sanctioned budget. The total price tag now stands at a breathtaking €2.24 billion. I mean, just look at the sheer scale of that jump when you see it laid out like this. The cost didn't just rise, it completely exploded, more than tripling in just 8 years. This wasn't some minor budget tweak. The state was now funding a completely different financial reality. So, how could this even happen? Well, a government-commissioned review by PwC pointed to one core reason above all others. The state had fundamentally underestimated the real cost from the very beginning. Simple as that. Sure, other things like VAT and inflation played a role, but the project was basically built on a flawed financial foundation from day one. Okay, so that's the money. Now, let's look at the second pillar of this failure, time. The hospital isn't just wildly over budget, it's years and years behind schedule. The promised opening dates have become a complete calendar of chaos. The promised opening dates really do tell their own story of failure, don't they? First it was 2020, then it was 2023, the contractor's latest target is late 2025. But, and this is the crucial detail, even if they hit that target, there's a mandatory 9-month commissioning period. That means, as officials themselves admit, June 2026 is the absolute earliest a single patient might be seen. That's a 6-year delay, and it's still counting. And this quote, it just perfectly illustrates the misplaced confidence at the start. As far as I know, no asteroid has hit, yet the hospital is still a construction site. That quote has really come to symbolize the project's long list of broken promises. So, what's actually causing all these endless delays? Well, a huge part of the answer lies in a bitter, incredibly complex and fantastically expensive legal war between the state's development board and the main contractor. Just consider this number for a second. The contractor has submitted over 3,200 separate claims for more money and more time. This isn't just a simple disagreement over a contract, it's a total deluge of legal disputes that has clogged the entire project. So, who's to blame? Well, if you asked the state's development board, they'll tell you the contractor, BAM, has failed to put enough workers on site. But BAM argues the complete opposite. They say that thousands of design changes coming from the client have made meeting any deadline impossible. The real truth is probably buried somewhere in the middle of all that, tied up in court proceedings. Now, at the heart of this whole financial battle is a really critical legal mechanism. It's called payment under bond. In simple terms, it means that if a mediator makes a preliminary ruling in the contractor's favour, the state has to pay up immediately, even while it's still appealing that very same decision in a higher court. And here's the crucial point, the result of that system. Thanks to that mechanism, over €100 million of public money has already been transferred to the contractor, all while the state insists it's still fighting the claims and that no final liability has been decided. The cash is moving, even if the blame isn't. You know, all of this brings us right to the heart of the matter. We have a project that is billions over budget and years late. In any normal system, you'd expect heads to roll, but what we find here is a shocking accountability gap. It's the question every single taxpayer is asking. After a failure on this monumental scale, surely there were consequences for the people in charge, right? Well, the contrast is pretty stark. You have official reviews, like that one from PwC, which found profound weaknesses in governance, in planning, in oversight. But then you look at the reality of what happened next, and it's pretty much nothing. No minister was fired, no senior civil servant resigned over the failure. Sure, there were some board level resignations early on, but the core system and its leaders, they all remained in place. Now, in the face of all this, a really strange defence has started to emerge, that the hospital isn't actually the world's most expensive, but arguing over its exact rank on some global list that completely, totally misses the point. Let's just put this cost into some context. Ireland's Children's Hospital is significantly more expensive than global landmarks like the Burj Khalifa. And maybe the most damning comparison of all, it's nearly 7 times the cost of the UK's highly regarded Alderhay Children's Hospital, which is a comparable facility that opened back in 2015. So the real scandal isn't about some global ranking, it's the toxic combination. Ireland is paying a premium world landmark price, but what it has received is a project defined by chronic delays, endless legal fights, and a complete breakdown of state oversight. That is the failure. And all of this leaves us with the most important, and frankly the most troubling question of all. Look, this project will eventually get finished, but if a failure, this public, this expensive, and this damaging results in no meaningful consequences for those who oversaw it, what lesson has actually been learned? It suggests a system where failure is tolerated and the real price is simply passed on to the public and, of course, to the children who are still waiting.